In this particular episode, let me try to explain to you about preventing diabetes. When I'm saying preventing diabetes, I'm speaking about preventing type 2 diabetes. Why am I confining myself to type 2 diabetes? Because type 1 diabetes is not something that we can really intervene and do much about, i.e., we can't prevent type 1 diabetes at this juncture. And type 2 diabetes is about 90% of the cases anyway. So we're in the midst of a big epidemic of diabetes and obesity. When I say diabetes, I'm speaking about type 2 diabetes in this particular episode. And if we don't act on it, i.e., if we don't take measures to prevent it and also to intervene early on, I think we will end up developing type 2 diabetes in a lot number of people, and that might lead to a lot of healthcare complications and burden on the society and individually as well. So we have somewhere around 8 to 9 crores of diabetes patients in India at this juncture, and these numbers might go to somewhere around 14 crores by 2045 by one estimate. So big numbers really. So let us look at the various risk factors that can lead to type 2 diabetes. There are modifiable and non-modifiable risk factors. Speaking about non-modifiable risk factors, we do have age. We can't change age. As we grow, our chance of developing type 2 diabetes increases as we age. And speaking about race and genes and family history, again, this is not something that we can really modify. So let us look at modifiable risk factors, because this is where the prevention aspect comes into play. Firstly, it is all about obesity, because obesity is one of the biggest risk factors for type 2 diabetes. If we can prevent obesity, I think we can restrict the number of cases of type 2 diabetes significantly. So I think we should try to prevent obesity at any cost. When we speak about obesity, again, it can be due to genes, which we can't change, but there are a lot of things that we can change. For example, leading a healthy lifestyle, sleeping on time, eating the right kind of foods, exercising regularly. All these things, if at all we were to follow those, then that would certainly decrease the risk of obesity and also decrease the risk of type 2 diabetes. So ladies and gentlemen, do not lead a sedentary lifestyle, be active, do exercise regularly, eat the right quantity of food in the right and the right type of food as well. Eat a lot of fruits and vegetables, high fiber diet. Stay away from junk food as much as possible. Even if it were to be the right kind of food, eat in moderation. So moving on from diet, exercise, preventing obesity, let us discuss about smoking. Smoking can increase the risk of type 2 diabetes because it causes insulin resistance. So please stay away from smoking. This apart, there are a lot of other complications and diseases that smoking can cause. So by all means, please stay away from smoking. Hypertension. Hypertension is one of the risk factors for diabetes. Directly or indirectly, it can be associated with type 2 diabetes, and most of the risk factors for hypertension and diabetes are common. So stay away from all those risk factors. Coming to other aspects, if you were to be somebody with pre-diabetes, I think it's very important to ensure that you keep a track of your blood glucose readings periodically, discuss with your doctor, and wake up if you haven't been exercising thus far, and start leading a healthy lifestyle, eating the right quantity of food and of course the right type of foods as well. If you wake up now, you can prevent or at least slow down the progression of pre-diabetes to type 2 diabetes. Important risk factor is gestational diabetes. If a lady were to develop blood sugar levels in the elevated range for the first time in pregnancy, we call it gestational diabetes. And if somebody has had a history of gestational diabetes, it is very important to ensure that they take extra care after the delivery, because some of these cases turn into type 2 diabetes every year. So gestational diabetes is a risk factor for type 2 diabetes, and one needs to take extra care in order to prevent or slow down the progression to type 2 diabetes thereafter. Polycystic ovarian syndrome is another risk factor for type 2 diabetes. If you have been diagnosed with polycystic ovarian syndrome, ensure that you tackle the modifiable risk factors, the ones that we have discussed, because obesity is one of the important risk factors for polycystic ovarian syndrome and type 2 diabetes as well. Lead a healthy lifestyle. So it all boils down to leading a healthy lifestyle, eating the right kind of food, exercising, staying away from smoking, and I mean, these are very simple stuff that we all can follow in order to avoid such a dangerous disease called type 2 diabetes. So the onus is on us to ensure that we follow all these precautions in order to avoid type 2 diabetes. Choice is yours. I told you what we can do to prevent type 2 diabetes. Take care.